Erectile dysfunction, also known as impotence, is the inability to achieve or maintain an erection firm enough for sexual intercourse. It is a common issue that affects many men, particularly as they age, but it can also occur in younger men. It can be caused by physical, psychological, or lifestyle factors and can impact the man's self-esteem, relationships, and overall quality of life. Causes of erectile dysfunction. Erectile dysfunction can result from various causes, which are typically classified into physical and psychological categories. 1. Physical causes. These are the most common causes of erectile dysfunction and include conditions that affect blood flow, nerve function, and hormone levels. Cardiovascular disease. Conditions like heart disease, high blood pressure, and atherosclerosis, hardening of the arteries, can reduce blood flow to the penis. Diabetes. Diabetes can damage blood vessels and nerves that are crucial for an erection. Obesity. Being overweight can contribute to both vascular and hormonal issues that cause ED. Hormonal imbalances. Low testosterone or other hormone-related issues can contribute to erectile dysfunction. Neurological disorders. Conditions such as Parkinson's disease, multiple sclerosis, spinal cord injuries, or stroke can interfere with nerve signals needed for an erection. Medications. Some medications, particularly those used to treat high blood pressure, depression, anxiety, and prostate conditions, can cause ED as a side effect. Substance abuse. Excessive use of alcohol, smoking, or illegal drugs can damage blood vessels or impair nerve function. Peyronie's disease, a condition in which scar tissue forms inside the penis, causing painful erections and erectile dysfunction. 2. Psychological causes. Psychological factors can also contribute to or worsen erectile dysfunction. Stress, work, financial, or relationship stress can interfere with sexual performance. Anxiety. Performance anxiety or general anxiety disorders can lead to erectile issues. Depression. Depression often affects sexual desire and may contribute to ED. Relationship problems, conflicts, lack of communication, or emotional distance in a relationship can cause or exacerbate erectile dysfunction. Symptoms of erectile dysfunction. The main symptom of ED is the inability to get or maintain an erection. Other related symptoms can include reduced sexual desire, a noticeable decrease in interest in sexual activities, inconsistent erections, being able to achieve an erection sometimes, but not consistently enough for sexual activity, inability to maintain an erection, difficulty maintaining an erection during sexual activity. Diagnosis. Diagnosing erectile dysfunction involves a physical exam and discussing symptoms and medical history with a healthcare provider. Various tests may be performed to determine the underlying cause. Physical examination. The doctor may examine the penis, testicles, and check for nerve sensations. Blood tests. To check for underlying health conditions like diabetes, heart disease, or low testosterone. Urinalysis. Used to check for diabetes or other underlying health issues. Ultrasound. A specialized test that evaluates blood flow to the penis using sound waves. Overnight erection test. This test checks for normal nocturnal erections to determine if the cause is physical or psychological. Psychological evaluation. If a psychological cause is suspected, the doctor may ask questions about stress, depression, or other emotional factors. Treatment options. Treatment for erectile dysfunction depends on its underlying cause. In most cases, a combination of treatments may be recommended to improve sexual function and overall health. 1. Medications. Several oral medications are available to treat erectile dysfunction by enhancing blood flow to the penis. These include sildenafil, diagrotobulafol, cializvornafil, levoprotenafil, stendra. These drugs belong to a class of medications called phosphodiesterase type 5 PDE5 inhibitors, which help relax blood vessels and increase blood flow to the penis during sexual stimulation. They are effective for many men, but they can have side effects, such as headaches, flushing, nasal congestion, and dizziness. These medications are not suitable for men taking nitrates for heart conditions. 2. Lifestyle changes. Improving overall health through lifestyle changes can help prevent or improve erectile dysfunction. Quit smoking. Smoking damages blood vessels, reducing blood flow to the penis. Exercise regularly. Physical activity improves circulation and can reduce the risk of ED. Healthy diet. Eating a balanced diet that supports cardiovascular health can improve erectile function. Weight loss. Losing weight can help reduce the risk of erectile dysfunction, particularly in men with obesity. Limit alcohol. Excessive alcohol consumption can worsen erectile dysfunction. 3. Psychological counseling. If ED is caused by stress, anxiety, or other emotional factors, counseling or therapy can be beneficial. Cognitive behavioral therapy (CBT) or sex therapy can help address underlying psychological issues and improve sexual function. 4. Vacuum erection devices. The EDA vacuum erection device is a non-invasive treatment that involves placing the tube over the penis and using a pump to create a vacuum that draws blood into the penis, causing an erection. A constriction ring is then placed at the base of the penis to maintain the erection. 5. Penile injections or suppositories. Alprostadil can be injected directly into the base of the penis or inserted as a suppository into the urethra to induce an erection. This method can produce an erection within minutes, lasting up to an hour. 6. Hormone therapy. If low testosterone is contributing to erectile dysfunction, testosterone replacement therapy (TRT) may be recommended. This can be administered via injections, patches, gels, or tablets. 7. Penile implants. For men who do not respond to other treatments, surgical options like penile implants are available. There are 2 types. Inflatable implants. A pump placed in the scrotum allows the man to manually inflate the implant to achieve an erection. Malleable implants. These are semi-rigid rods that keep the penis firm but flexible. Prevention. While not all cases of erectile dysfunction can be prevented, certain lifestyle choices can reduce the risk. Maintain a healthy weight. Obesity is linked to ED, so keeping the healthy weight can reduce the risk. Exercise regularly. Regular physical activity improves circulation and cardiovascular health, both of which are critical for erectile function. Manage stress. Reducing stress through relaxation techniques, hobbies, or counseling can help prevent psychological causes of ED. Limit alcohol and avoid drugs. Reducing alcohol intake and avoiding recreational drugs can prevent ED. Get regular checkups. Routine visits to the doctor can help catch conditions like diabetes, high blood pressure, or high cholesterol early, reducing the risk of ED. Conclusion. Erectile dysfunction is a common condition that can have a significant impact on a man's quality of life, but it is highly treatable. Understanding the causes and exploring the available treatment options can help men manage the condition and restore sexual function. Consulting a healthcare provider is the first step toward finding an appropriate treatment plan.